Good evening. Thanks for being here. We begin tonight in the Comox Valley, where nurses say the recent changes at St. Joseph's Hospital are compromising patient care. A transitional care unit was opened last month at St. Joe's, and the nurses say it is leading to overcrowding and overworked staff already. They say they're also afraid that this new unit could open the door to user fees of almost $30 per day. A News reporter Gord Kurbis has the story.
It looks like a campaign vehicle, and in some ways, that's what this motorhome is. It's a traveling meeting room for the BC Nurses Union, campaigning for change. It's plastered with images of smiling nurses, but the mood inside isn't so cheery.
We're doing some follow-up with the nurses here as a result of some of the concerns they've raised, and also to make sure that the public stays aware that this is a facility in transition and under some stress.
A steady stream of nurses traveled in and out of the motorhome today, meeting with union executives. They're talking about what they say are serious concerns at St. Joseph's Hospital.
I'm here to meet with the nurses, talk with them one-on-one, listen to what their issues are, prepare the nurses to raise these issues with their management, as well to invite the public not to forget about St. Joe's.
The issues surround a change in the hospital's operations. In September, a new transitional care unit was opened, something the nurses say has resulted in the overcrowding of remaining medical surgical beds.
And we have nurses that are foregoing their breaks trying to get the workload done. And like I said, the workload is horrendous. So when you have a high workload and you're running your feet off, how do you feel that you're going to get quality patient care on that unit?
In May, nurses rallied outside the hospital, urging the public to support their fight against the changes. Nurses are hoping members of the community will now step up their objections.
I need the public to be outraged on this. The public needs to be aware of what's going on. They need to pay attention. The patients that are in these units, on these floors, in these beds, need to speak out.
The nurses hope if they apply enough pressure to the local hospital and Vancouver Island Health Authority, administrators will be forced to consider their input.
The nurses have solutions. They know what they're doing. I really wish they would listen to them as the educated healthcare professionals they are and work with them to resolve some of these long-standing problems.
The union fears the transitional care unit is just the first step in the wrong direction, and that it may lead to the hospital introducing new convalescent care fees, something the nurses say patients can ill afford. In Comox, Gord Kurbis, A News.